Hello, everybody, and welcome to another episode of the Abundant Wellness Podcast. My name is Andrea Jones. As you've heard in the intro, I'm not going to go back over all that I am and all that I do, but I'm excited that you're here. If you're watching me on YouTube, I want to make sure that you give me a like, follow, and subscribe. I talk about all things mental wellness, emotional wellness, and spiritual wellness. And today I'm going to be talking to you all about the role of the microbiome in your mental and emotional and spiritual health. So I had several people on Instagram and in my emails submit questions, very common questions that I get about why we would want to do microbiome testing, when and how to use it, et cetera, et cetera, et cetera. So I'm excited to go through those questions with you today, and also share some personal testimonies of how microbiome testing has helped me, and some case studies for my clients. So let's just dive right in. And please make sure, if you are watching this video or listening to the podcast, to head on over to Instagram and shoot me a question in my DMs or comment below. So what is the microbiome and why is it important for our overall health? So the microbiome, that word is kind of a catchphrase that maybe many of you are very familiar with, but essentially the microbiome, what that means is the microscopic basically ecosystem in the gut of various strains of bacteria, including pathogenic bacteria and beneficial bacteria. If we were to just break it down into those two main categories, pathogenic and beneficial, that would be like the very basic information that you need to know. Your entire body is actually made up of bacteria, including your skin cells, the health of your skin, the health of your hair. All of those things actually are in part controlled by your microbiome. And I'm going to be sharing some statistics with you to help you understand um, just how important the microbiome is in our mental, emotional, and spiritual health. Okay. A lot of people are walking around struggling with what they feel is a mental health disorder that really is a microbiome disorder. Now, Hippocrates, if you look way, way, way back, Hippocrates gave this quote that all disease begins in the gut. And we are finding out now, with all of the scientific research and evidence that we have, that he was actually right. Now, I want to share with you, as I go through these questions, some pitfalls to testing, some questions that I've gotten from people when they're trying to decide if they want to do testing, which route to go when they're considering microbiome testing, and how different behaviors, might indicate whether or not that's needed. So we will go through all of that. But the microbiome, if you think about it, is the microscopic ecosystem that makes up your gut, that makes up the communication between different bacteria, fungi, viruses in your digestive tract that influence mood, energy, behavior, metabolic function, and your overall health. All right, so let's go to question number 2. Can you explain how the microbiome influences our mental and behavioral health? Absolutely. So we know that about 70 to 80% of our neurotransmitters. Now, our neurotransmitters are the communication system within our brain, that communicates within different parts of the brain. And we know that, the most well-known neurotransmitters would be serotonin, dopamine, norepinephrine. Those would be the three most commonly well understood neurotransmitters, I should say, by the lay public. They're the most commonly heard neurotransmitters. We typically associate dopamine disorders with something like attention deficit disorder. We typically mentally associate serotonin disorders with anxiety and depression. And while it is far more complex than that, those neurotransmitters, about 70 to 80% of them are actually made in the digestive tract, which means that the food that you eat, the stress that you're exposed to, your emotional environment actually is what creates that microbiome balance, and it's actually the bacteria in the digestive tract that create that 70% of neurotransmitters. So when we're talking about the role of something like an antidepressant or an anti-anxiety medication, I'm going to take those off because they're pinching my ears a little bit here. When we're talking about the role of something like an antidepressant or anti-anxiety medication or even ADHD medication, we know that those medications, I'll just talk specifically about an SSRI, so a selective serotonin reuptake inhibitor. And what that means, you guys have probably all seen the commercial with the little neurotransmitters that are kind of communicating with each other. What that means is that it is only helping your body to recirculate what you already have in the brain. So if you have a serotonin deficiency, meaning that your gut is not making enough serotonin, um, it's not making enough of the bacteria that help to produce serotonin, there's not going to be enough recirculating. And this is why we typically see a regression in symptoms, um, usually about 1 to 2 years in, sometimes sooner when taking an antidepressant. And that's again because it's only able to recirculate what you already have in the brain. So if there's a deficiency, the deficiency isn't in the brain most of the time. The deficiency is in the gut. And so if we can support the production of serotonin in the digestive tract through things like walking, prebiotics, probiotics, reducing stress, balancing hormones, we will have a much healthier impact on our brain and our neurotransmitter function. Okay. So that is the primary way that the microbiome influences our mental and behavioral health. I wanted to share a little kind of personal story with this. So, my youngest daughter was about 5 at the time that this happened, so about 4 years ago, I think. She had gotten a bladder infection that we had to use antibiotics for, which I don't love using antibiotics, but they do have their time and their place. Um, and in this case, we needed to use antibiotics. I had been giving her probiotics with the antibiotics, but they were not very specific to what I should have been doing at the time. And I'll talk a little bit about that as well. Now, when she finished that round of antibiotics, I noticed that she was very irritable and snappy and like not like herself, very grumpy and bossy and demanding and just like not herself. She's a very easygoing kid. And I was like, this is not normal for her. And like for her to be on probiotics, like I'm just a little bit concerned, something's going on here. Well, one of the most common side effects, not side effects, one of the most common impacts of being on antibiotic therapy is that C. diff and E. coli can overpopulate in the gut. And we know that C. diff, difficile, I probably said that wrong, and E. coli are extremely neurotoxic. And what that means is they are really, really irritating to that neurotransmitter space. And so they begin to compete with serotonin receptors in the brain. And so I decided to do a comprehensive stool analysis. This was the first one that she had done at that time. And sure enough, C. diff and E. coli came up. Now they were not above, how do I say this? They were above where they should have been, but they were not high enough to cause common symptoms of E. coli, which would be like bloody stool, watery diarrhea, vomiting, like those kind of things. They were not high enough to cause digestive symptoms, but they absolutely were high enough to be causing irritation to the brain. And I've actually seen this pattern with 3 other clients as well that noticed neuropsychiatric symptoms after finishing a round of antibiotics. And that was because when you take antibiotics, they wipe out the entire microbiome, not just the bad bacteria, but the good bacteria as well. And it doesn't automatically balance itself out. In fact, most research shows that it takes at least 6 months to replenish the microbiome after one round of antibiotics. So it is not uncommon at all to experience neuropsychiatric symptoms, meaning mood, behavior, sleep changes, after being on a round of antibiotics. And again, it's because it's wiping out all of the beneficial bacteria that you need to create serotonin and dopamine, while also allowing those pathogenic bugs to grow, which is a very big problem. It's a very big problem. So at a bare minimum, if you're noticing behavior, mood changes in yourself or your child, after being on a round of antibiotics, it absolutely would be worth doing what I use is the BiomeFX comprehensive stool analysis, working with a practitioner that can help you to identify those patterns. Um, okay, so question number 3, what specific aspects of mental health or behavioral issues can be impacted by microbiome imbalances? So this is a really good question, and it kind of just goes right from the question before. I would say that all of you is impacted by your microbiome. All of you is. And so there isn't one aspect of you that's not going to be impacted by microbiome imbalances. But let's just stick with some maybe more common things that we see. So we know that there are specific bacteria that will cause insomnia. We also know that insomnia causes changes to the microbiome. It's a two-way communication system. If you think about your brain and your gut, they're communicating in both directions all of the time. However, the research shows that most of the communication is actually coming from our gut to our brain and not our brain to our gut. Okay. So when we're talking about what specific aspects of mental health or behavioral issues can be impacted by microbiome imbalances, I'm going to break this down a little bit further for you. When the microbiome is compromised, because let's say you have an overgrowth of bacteria in the wrong place, or you have we'll just stick with that one because that's like the most common one, or an imbalance in the ratio of specific bacteria. This will cause issues with mood and behavior. We know that when bifidobacterium, specifically, that species is really low, that we are likely to experience an increase in symptoms of anxiety. So maybe ruminating thoughts um, or racing thoughts in the middle of the night or negative thinking, because that bifidobacterium species is what directly correlates to increasing serotonin. So we also know that when the microbiome is compromised, so again, we're going to go back to that dysbiosis, understanding dysbiosis, which is an imbalance in the ratio of beneficial and non-beneficial bacteria. When we have that happening, we start to lose our ability to absorb specific nutrients, number one. We also increase inflammation to the digestive tract, which then leads to something called leaky gut or SIBO, small intestinal bowel overgrowth, or small intestinal bacterial overgrowth, which then causes malnutrition because we're not absorbing nutrients. So let's take for an example within this, if we're not absorbing nutrients, and we know that we need to have B vitamins and zinc and magnesium at a bare minimum to make a serotonin molecule. We're not absorbing those nutrients, so we're not making the serotonin that we need, which means it's then not recirculating in the brain where we need it to be recirculating. That's one example of just like if we're just talking about anxiety or depression. Now, on the very maybe the more extreme end of the spectrum, let's talk maybe about something like schizophrenia. Now, schizophrenia is a pretty complex diagnosis, but from an orthomolecular medicine standpoint, we know based off of evidence and research that patients with schizophrenia tend to be very, very, very deficient in B vitamins. Now, there are multiple reasons for this. I'm not going to go into all of those reasons, but one of those reasons is that one, they're simply not getting enough in their diet. Two, they're not absorbing enough in their gut. And three, it's not recirculating in the brain where it needs to be. Now, I am not saying that B vitamins will cure all schizophrenia. That is not what I am saying, but it is one facet of that disease that does need to be looked at. And again, that comes down to we're not absorbing things in the gut the way that we should be, right? And that's a problem. So, those are just some aspects of mental health or behavioral issues that can be impacted by microbiome imbalances. So let's go to question number 4. So how does the gut-brain axis work, and what role does the microbiome play in this connection? So if you think about the gut-brain axis is a complex network, communication network of nerves and neurotransmitter signals. And this gut brain axis is actually primarily communicating through the vagus nerve. Now, the vagus nerve is a nerve that runs from the brain into every single visceral organ. So every organ in your abdominal cavity. And it communicates with also all of the rest of your nervous system. So primarily the gut brain axis communicates through the vagus nerve. Now, our vagus nerve gets disrupted primarily by stress. And this stress can be chronic or can be acute, but for most adults and even some children, it is chronic, meaning that they are experiencing high levels of stress all of the time. So there is an aspect of healing our microbiome that requires that we address our nervous system. It requires that we address our vagus nerve. It requires that we address our stress and our stress responses. So that is one of the ways that the gut brain axis works. Now, the flip side to this, I would explain this like top down, meaning from the brain all the way down into the nervous system, the enteric nervous system in our body and through our vagus nerve. That would be a top down approach. And then we have a bottom up approach, right? Which is the vagus nerve that's innervated into our all of our vital organs, communicating up to our brain. Okay. So the flip side to this is that we know that there are things like brain injuries. We know that there are things like, whiplash, that would impact the top down approach of our microbiome. So, what I'm saying with that is that it works both ways. We have to address all of the different aspects of our mental, emotional, and physical health that are impacting our microbiome. Number 5, and actually, I might split this up into 2 parts because these are really good questions and I think it deserves my full attention. So, what are some common signs or symptoms that might indicate a microbiome imbalance? I actually love this question, and I will drop in the comments a link to an assessment that I use that is super comprehensive and will help you to identify maybe some patterns that are impacting your microbiome. Number 1 is your digestive symptoms. So, we're talking about how often you have bowel movements, how easy they are. Are they firm, formed, solid? Are they easy to pass? Do you feel like you have eliminated fully? Are you going at least 1 time per day, if not 2 times? 2 times would be ideal. Those kind of symptoms, gas, bloating, fatigue, constipation, diarrhea, those kind of symptoms, belching, that's a big one, heartburn. Those are very, in my opinion, important warning signs that your digestion is going to impact your mental health at some point. Leaky gut, for example. So if you have food intolerances, where the lining of your digestive tract is compromised and it's allowing proteins in through the digestive tract into the brain. So if it's passing through the digestive tract into your bloodstream, it is going to impact your brain. And that can create some neurotoxicity, neuroexcitability that is not beneficial. Um, all of those things will eventually impact your mental and emotional health because your gut is compromised. So, any of those GI symptoms, I would say, would indicate a microbiome imbalance. Like I talked about, my daughter's behavior was off. She was irritable, snappy, moody. Another one that we commonly see is insomnia, anxiety, depression, hopelessness. Obviously, there can be a lot of other reasons why that's happening, but it is really important to assess what's going on in the gut. Attention deficit disorders, any mood and behavior disorder, we would want to be looking at the microbiome. Um, those would be the ones that I would think of off the top of my head, but I would say take a look at the GI assessment. Um, and that form is a private form, meaning that it's sent through my privacy protected portal, and then I give you some direct feedback in that website if that's helpful for you. And stay tuned, make sure to like, follow, and subscribe for part 2 coming next week.